What are you doing?
So I'm just reviewing my morning case. We did a double whole arch procedure. I used for the first time the DitraFiber bone graft plug. It's 100% allograft and it expands in the wound once hydrated. So the directions say to hydrate it with a sterile solution. I use the patient's heme for some added growth factors, and it expands and holds its volume better than the other bone grafting plugs I've tried, and I've tried them all.
So I'm seeing it saved you time to make your Ditron implants into a cute little pyramid.
It did, so much time, but it is so convenient to just be able to take the graft material, hydrate it, place it in the wound, compress it a little bit, and watch it hold its volume as opposed to trying to pack particulate allograft or anything else. So I really like it for whole arch surgery, and I'm probably going to start using it for socket grafts and things like that.
Awesome. Thanks, Dr. Goudreau.